Welcome back to Taking Charge of My Cancer Podcast, episode 79. I have the pleasure to have with me Rachel Bolger. She is a third-year DPT student from the University of North Florida, completing a 9-week final clinical rotation with us here at the oncology team at Med Plaza in Gainesville. She completed her undergrad degree in family and child science from Florida State University in 2021. She has complete pelvic 1 and 2 certifications through Brooks Rehab and has a special interest in working in oncology and pelvic floor as she graduated this coming May 2024. So Rachel, welcome to the podcast and thank you for being with me today.
Thank you for having me.
Absolutely. So you want to tell me a little bit about your role and where you always planning to do this?
So in full transparency, when I was very young, I thought I wanted to be a doctor. My middle brother went through med school and I was in high school at the time and decided that wasn't quite the route I wanted to go down. I had done some shadowing in the hospital and just didn't feel like the MD route had as much patient care. And so going into college, I was a little indecisive of what exactly I wanted to do. I knew I wanted to work in healthcare since I was really young. So I knew it was going to be something healthcare related, but I didn't get the patient interaction that I wanted from the MD side. So I thought maybe nursing, maybe PT, maybe kind of all these different things. And I grew up in a military family. And so I was around a lot of amputees. My dad was a med group commander, so I got to shadow in physical therapy clinics a few times. And I kind of grew a passion for that. And then when I shadowed again in undergrad, I really enjoyed the patient interaction that we got to have with patients in physical therapy. And it ultimately decided my route towards going to physical therapy school upon graduation.
Great. How did you land in this internship? Why oncology?
So kind of a diversion to what I originally thought I was going to do, because going into PT school, I would have told everybody I'm going to work with military vets. I want to do amputees. And I really enjoyed that and thought that's what I wanted to do. And then we took prosthetics in our DPT program. And I realized soon that that was not my specialty, was not what I love to do. And so I quickly started trying to decide what else I liked. And so I had some interest in pelvic floor after taking some of those courses. And then we had a day in PT school about lymphedema. And I had this like little spark that ignited in me. And I think that stemmed from the fact my mom had breast cancer and went through a lot of oncology treatments. And then my passion for oncology kind of grew from there. And so when we were given options of where I could potentially end up and make a list for PT school, or for our clinicals in PT school, I had put UF Health as number one because I wanted to try to gain some exposure in the oncology setting.
Right. Will you be able to give us some valuable tips for patients with cancer from the student standpoint to other students, from what you have seen with patients and the experience that you live with actually your mom?
Okay. I think the number one thing, having been here and to patients, is to be like, you are your own advocate. No one can do the work for you in a sense. And if there's a specific route some people want to go, you have to be able to verbalize and advocate for yourself and do the research yourself. So just looking into research, advocating for what you know is right, and taking time to really consider all your options. From the student standpoint, what was your question about students? Sorry.
Like what kind of tips would you give to other students who wanted to come and do any kind of internships in this type of setting?
Yeah. So for students, I would say everything you learn in school, kind of take it with a grain of salt when it comes to what you are taught in school about oncology. Because I feel like a lot of what we hear about is don't do mobilizations, be careful about soft tissue, be careful about all of your modalities, and maybe you can't do this with patients and you can't do that with cancer patients. And I think coming in with an open mind and realizing that you can do a lot more with patients than you like we're taught in school. And I think it's just the education hasn't quite caught up with the current literature. Sometimes I think there's just a fear of like what you could do to a patient, but really making sure that you educate yourself and what you're allowed to do, and coming in with open mind and what you will learn to do as you are in the clinic, oncology clinic.
Great. How about for caregivers or kids who have parents dealing with cancer? Like, how old were you when your mom got diagnosed?
I was very young. I was only 2, so I don't remember a lot of it. But my brothers were much older. They remember it. I think the big thing is especially caregivers. I was a family and child science background, and so a lot of our our education in school talked about caregiver burden and making sure to find ways to make sure the caregiver as well as the patient are getting good mental health resources, taking time when they need it, because as a caregiver, if you're not taking care of yourself, then you're not going to be able to best take care of the patient.
Yep, that's perfect. Yeah. I remember that it's not as a caregivers, when we have our significant other hurt, we tend to do everything for them without realizing that we are enabling them, right? So it's important when we are seeing these patients. I always like to bring the caregivers along to their appointments. And then when I do the evaluation, able to explain to them why it's important for the patients to do as much as they can when they can, depending on what situation and under which circumstances. But used to be years ago that you have a diagnosis with cancer, and then the family is like, you don't do anything. You just stay in bed. I'm gonna bring food to you. You don't do a thing because, well, you don't need it because you're gonna get sick and you're just too weak. Just rest. And we know that that's not really the issue, like that's not like that at all, because that's only gonna make things worse with all these other secondary effects from cancer treatments. So we are actually going the opposite, right? Keep your life as normal as you can possibly keep. And that's gonna be so much better outcomes for everyone. But sometimes caregivers don't understand that because they just wanna protect them, right? I just wanna make sure that, oh, don't do anything because you're gonna get hurt. So sometimes it's important to really have that conversation and bring them back and then show them like, it's okay to move, it's okay to work on the scars, it's okay to exercise, it's okay to do so many other things that, so they hear from us. Because sometimes it's like either the patient is afraid to move, or like I say, the person who is taking care of them don't want them to move. So it's important to have education with both.
I think that's interesting because I think I had to learn that journey too, coming from that mindset of, oh, I can't do anything with the patient. So not only the patient, but as a student, I kind of had that journey of realizing everything a cancer patient is like capable of doing.
Exactly. What is a painful lesson that you learned along the way as a PTA student, and then in relation to that, and then in relation with the patients that you have been treating here with me?
Painful lesson. I think PT school is the biggest painful lesson, is just having good time management. I think if you have good time management, you'll do perfectly fine. And that's something that you just develop along the way. When it comes to being here with you, I think kind of falling back on that, getting out of the mindset that we can't do this with cancer patients and we can't do that, and being willing to try things was kind of hard for me, just because I was told in all of our courses and everything we studied. So I probably those two.
Okay, great. I'm glad to hear that, because again, we talk about this quite often, right? How many times you hear it's such a little evidence. We're still in so many things we do in our profession. And so we have a lot of evidence in certain things, and we don't have as much evidence. And oncology is evolving, and I know it's more research coming out and more things coming out with rehab and exercise, but there's certain things that certainly still not having evidence. However, anecdotally, we see huge improvements, right? We just don't have a way to prove it based on research yet. But like, many times, like, visceral mobilization, for instance, contraindication is cancer. Well, you see, we've been doing that in patients who actually is going through cancer. It is no evidence saying that that's going to spread your cancer, right? And everything is about quality of life. So let's give it a try for something that is going to really improve your quality of life, what is going to make, help you to do what you used to do before or even better. So, so many things out there that, oh yeah, if I do this, this is going to really spread my cancer. And it is not. So many myths that we need to try to continue, really stay up with then research somewhere else and then just really see, okay, is that really happen versus if it's not, what are we telling the patients this if it's no evidence, right? So we shouldn't be, if it's no evidence, we shouldn't tell, no, that's a contraindication if it is no evidence, right?
Right.
So it's kind of like MLD when you have a patient with a stage 4, type of cancer diagnosed, and you say, well, no, we shouldn't be doing MLD on somebody who has active cancer, then how are we going to give that quality of life of this patient who is a stage 4 and have a big limb that is, has lymphedema and has a stage 4? No, we can totally do that. And it's no contraindication, and those patients' quality of life is going to improve so much, and we live in it here day in and day out. So yeah, so it's just a matter of like, just kind of make sense of things, maybe look into other research from like the medical standpoint and make sense out of it. If this from the medical standpoint and the physiological standpoint doesn't make sense, then why are we creating contraindications in some of the modalities and the things that we use, right? So
I think we see that a lot with lymphedema itself too. And like people are scared to do blood pressure, do all these different things that now it's kind of coming out that maybe we don't have to be as strict as we once were. But you hear even my mom is like, I can't give blood. I can't take my blood pressure on this side of my arm because those are the things that she was told so many years ago.
yeah, and that was the things that were told up to, it still happen today, right? And so many hospitals and so many places, they put a no on the arm that had a breast cancer for any kind of withdraw blood or blood pressure. And we know that, new research, not as new anymore, has been out for 3 years showing that low risk patients that's no evidence base that that's a contraindication to do, blood pressure and withdraw blood, or even, the use of a sleeve when you travel by plane. So again, hopefully we're all looking into evidence with high risk patients. We're working on that to see if that's really true that we should be telling patients that. So that really is calming a lot of patients down. Even, one of the Dr. Spiegel, the breast cancer surgeon I work with, like she was actually saying, so many times the anesthesiologist asked her, if I have a bilateral patient, can I go ahead and they don't have an arm to put their IV. And we know how painful it is on the leg and how it is really difficult to keep things going on the leg. For the anesthesiology itself, it's a pain. So why I keep doing that and making everybody working harder and even for the patients if we don't need to? So they're really looking into all that now, which is great. What it means to advocate for yourself and how can people do that?
To advocate for yourself, I think starts with knowing what it is that you're advocating for. Because I think if you go into things and you don't really know your research, you haven't looked into what you're doing, you're not going to be in the best situation to advocate for yourself. So for patients, that often looks like looking into your research, talking to other healthcare professionals and others that you know who've been through the situation to figure out what it is exactly that you are wanting to advocate for yourself. And then using that knowledge and having the resources to back yourself up. I think that would go a long way, especially in talking to other doctors and people that you're ultimately advocating to either alter treatment or change the current plan.
Great. That's very good. How about as a student?
As a student, I think we are often very fearful of altering or going against the plan or kind of do as you're told. And maybe I am coming from a bias of coming from a military background and just always doing what I was told. But again, kind of similarly, if you know your information. If you've done like gone through your courses, you've researched, and you know that something isn't right, speaking up for it, or just even just showing the most current evidence. I know a lot of, I haven't had this experience with you, but I have with other CIs, where they just aren't up to date on the most current research. And so bringing it to their attention. And a lot of times it's as easy as just showing, because people don't always look for the most current research. And when they have it, not only are you then doing better for your patients, but you're also, they'll continue to use that hopefully as you continue on and after you've left as your rotation.
Yeah, and this is super important. I always tell you guys, I mean, you go, I graduated many years ago and was a bachelor's in PT. And even then, I think I have a great faculty who taught me, I don't need a physician to tell me what to do, because that's why I went to school for being a physical therapist, right? It's like the orthopedic doctor or the surgeon doesn't want, I don't need to be telling them what kind of a stitch to use or what kind of suture or what line to cut, right? That's not what I went to school for. So I always say that to you guys, don't let anybody tell you what to do, because that's why you pay so much money. And that's now you guys in the DPT, where you need to start to really put all that together and really educate physicians and educate not just physicians, but everybody else about the profession and what our knowledge is and what can we do. Like how many times you hear here, we are the ones who end up diagnosis patients after patients, and we are the ones who are telling them, hey, you may have to go back to the doctor and ask them for looking to ABC, right? Or we're reaching out to the physician and telling themselves, I'm suspicious of ABC. What's your thoughts? And can we do a diagnostics on this, right? So it is important. Again, I'm not pretending to be a doctor, but we got to be looking at that whole picture and always okay for the patients, right? And sometimes they don't have the knowledge. They don't have the voice. They feel like, well, if my doctor is not telling me this, is because I shouldn't be looking into that. But we know how healthcare is now, sadly, that the physicians don't have the time to really spend with the patients to be able to listen to them and then be able to come up with certain diagnosis, because everything is a rush. So I'm not saying everyone and in every place, but that's the common denominator that we see.
Right.
So it is important for us to continue working through all that to really help out. So I always say to my students, right, don't go out there. And even if you have a rough CI or a CI that is just really not being the greatest in regarding just asking you to do too much or asking you things that you know is not up to date, don't feel bad to say, I think you may want to look into this. And I don't feel comfortable doing this. And don't feel afraid to do that, because, it's just, you have to have that conversation. We're all be colleagues, right? After you guys graduate, you shouldn't be just saying, because you're the student and I'm the CI, you do as I told you to do, right? I'm just giving you tools so you can become a better clinician. But at the end of the day, it's your decision, because you're going to be the one working on your own in a few months, right? So the whole idea is to make you the best possible way that you feel comfortable to making those clinical decisions, until you get more and more experience. So that is
Right.
so great. Is any good resources for patients to educate themselves or even for students?
For patients, I think Google Scholar goes a long way. You have to be careful in your research and what you're looking for in Google Scholar. I know it's harder for patients to sometimes find access to some of those scholarly articles and even sometimes understand them. Because I know even for me, I still sometimes have to spend hours trying to dissect what all is done in research. But it gives you an option, it gives you something to look for, and then you can always take it and talk to somebody who maybe has more of this knowledge, whether that's your PT or doctor, about things that you do find there. And then talking to other patients, I think, is a really valuable. If you can get in a support group, people who've gone through what you're going through, you'll get some invaluable information that you may not otherwise be able to find out yourself.
Great, awesome. How about any podcasts or books that you recommend to people?
For students, if you are sitting to take the NPTE, I would highly recommend the NPTE podcast. I wish I had more time during this rotation and just in general through PT school to start looking into other podcasts and books. Unfortunately, this rotation I was studying for the boards, and in school, time is so limited, especially if time management skills. Even with time management skills being pretty good, time just seems to fly by. So hopefully in the future, I'll have more podcasts and books I could maybe recommend. But right now, that's probably it.
Okay. How can people find you?
I am not a big social media person, so you can find me on Facebook, Rachel Bolger, Bolger. And then you're always welcome to email me at rtetla99@gmail.com.
Perfect. And I will add that to the show notes so people can have access to it.
Perfect.
Any other question you would like me to ask you before we wrap up?
I think that's it.
Okay, perfect. Do you think I put that seed on you to become an oncologist specialist, hopefully after you graduate in May?
I think that I had a little bit of the spark already, but I definitely, even talking to our preceptors at our university on my midterm call, who I've had her for multiple of my rotations, she said she could just hear the passion in my voice and how I felt, like she could tell how I felt about oncology, and that I definitely had more passion in the setting than anything else. And so I think that being here, you definitely have pushed me more into the oncology, hopefully upon graduation.
Awesome, great. And that's again, like I always say to all my students, that's my goal, right? It's like oncology is just growing so much, and it's such a neat field for a lot of us to be able to really jump in and doing things right and really help patients through this journey. And then try to really help to other professions to understand what can we do and what such an important role we play in a cancer diagnosis, and how we just kind of go with this journey from before, like at the time of diagnosis, all the way in survivorship. So I think that the more of you are out there, we can spread out and really help more people with this. That's the whole idea. So, well, thank you so much for being with me here for 9 weeks. And thank you so much for doing this podcast with me.
Thank you for having me.
Okay, you have a great rest of the afternoon.
You as well.
Bye.